pharmacotherapy. Pharmacotherapy in sexual health is first is the PDE5 inhibitors. What is PDE5 inhibitors? Is a phosphodiesterase. Action, how it acts? PDE5 inhibitors prevent the breakdown of cyclic GMP, causing enhanced relaxation of cavernosal smooth muscle inside the penile shaft and increase the arterial flow into corpora cavernosa. Compression of subtunical veins, compression, and finally penile erection. That is the purpose of phosphodiesterase. It means it's explain everything, anatomy of the penile shaft as well as how it acts. Now, erotic literature, fantasy and foreplay is very, very important, and we people are never taught to the patient, you take the Viagra, but it never said, open erotic, imagine yourself, or some film, you find out some sexy film or something, literature, or you have to provide, otherwise you have to ask them to buy, they will buy their own. Erotic literature, fantasy and foreplay help in initiation of erection. What is the contraindication of 5-phosphodiesterase nitrates? Because it's leading to hypotension, cardiac disease, hypotension, optic neuropathy, and erythromycin. And if the patient on erythromycin antibiotic, stop this. Because most of the skin diseases, erythromycin is still the choice of the drug. Erythromycin, rifampicin, if the patient on tuberculosis treatment, don't give 5-phosphodiesterase. Understand? Indication, contraindication, how it works. I have provided you. I know you have never opened it. You want only, sir, you are not perfect because you are never read the things. How I can do a hit? Sildenafil is a Viagra, Penegra, 25. Start with the 25, then 50. If not effective, 100 mg. Don't 30 minutes before intercourse, after dinner. 60 minutes, 30 to 60 minutes. Okay. Then Vardenafil, Levitra is available, 5 mg, 10 mg, 20 mg tablet, 30 minutes after dinner, onset action 30 minutes. Tadalafil, we start the 2.5 mg, 5 mg and 10 mg and 20 mg. But that's the problem is 20 mg, 10 mg patient having a back pain severe, and sometimes patient admitted in orthopedic and they have paid thousands of rupees for traction and all, remain in the hospital charge. So it's better to give in low dose, and it affects after 8 to 10 hours. So give them either after breakfast or after dinner. So that at midnight is effective. It's a work for 48 hours. And along with this, you can use another drug like sildenafil, that is a known Viagra, or that is in the form of strips also, that absorb mouth dissolving very fast and effective very fast for half hour. But this is not cure. So long the patient on the medicine, and patient will remain, and sometimes patient having side effects, and patient says, sir, abhi se band karna hai, kya kare? So again we are what we explained so far. Intracavernosa injection is a very important thing. Papaverine injection is a titrated 30-80 mg with one vial is and that is you use 15 units or 20 units in the 1 ml diabetic syringe, and with the bimix with a prostaglandin or papaverine with prostaglandin, or these are the various bimix and trimix combination, and that combination you can get it here. Some are the chloropromazine with intracavernosa papaverine, or phentolamine with papaverine and all. Oimbine can be given 2 mg, 1 TDS. Indoramine, and that is the alpha blockers. This second pharmacotherapy is alpha blockers. Alpha is an adrenergic receptor blocker, dilate the arteries and reduce the venous return. Tolazoline and various number, because hardly I am using. Oimbine I am using most frequently. Our intracavernosa injection we use only on a hospital basis, where urologists and others sometimes priapism is there and you have to remove immediately, and dose titration is very, very important factor. These are the very common complication is a medical legal. Pharmacotherapy in sexual health. Second is the first we have seen 5-phosphodiesterase. Second is alpha blocker. Third is the dopamine agonist. That is a dopamine agonist. One student was asking how the apomorphine is effective. Apomorphine is effective on the dopamine agonist. This drug stimulates the dopamine receptors. Dopamine is a neurotransmitter. It causes vasodilatation and has effects on motor, behavioral, and endocrine system. Bromocriptine also effective in few cases. You can try it, but I seen I tried apomorphine also 100 cases. Out of that, only 10 to 12, 20 patients are asking for the drug. Others are not. Means one or two patients in 10 patients getting a good result, but still, sildenafil is the drug of choice. Nobody replaces this Viagra. Antidepressants are used for the premature ejaculation. These are the selective serotonin reuptake inhibitor. It takes 3 to 6 weeks of continuous treatment for suppression of symptoms. They delay the orgasm. This effect is made use of in the treatment of premature ejaculation 2 to 4 hours before the coitus. Fluoxetine 10, 20, 30 mg. Paroxetine, you have to give the bedtime, you can say. Paroxetine or evening 10 mg, 30 mg, 40 mg. Trazodone 25 to 50 mg, and dapagliflozin very commonly used 30, 60 mg. Most of the urologists and sexologists. Psychiatrists use more commonly fluoxetine and paroxetine and all. Peripheral vasodilators are the used for the erectile dysfunction. Vasodilators dilate the blood vessels and cause erection. They are also used in hypertension. Hydrazine sulfate, Nepressol 25 mg tablet at bedtime. Nifedipine, Neflet 5 mg, 10 mg, 20 mg tablet TDS. Amlodipine, Amlodac 2 mg, 5 mg or 10 mg tablet OD. Pentoxifylline, Trental 400 mg tablet TDS after meals. Saclendral, Saclacin 200 to 400 mg TDS. Xanthinol, Nicotinate, Complamina 150 to 500 mg tablet TDS with a meal. L-arginine is very commonly used. Arginitric 500 microgram capsule, 3 gram sachet is available or 5 gram sachet is available. Arginine is precursor of nitric oxide that dilate the arteries and provide more erection. Now, my dear friend, 6th type of sexual medicine is local vasodilators. And what is local vasodilator? It's a nitroglycerin ointment available in the name of Myovine 2% in the 30 gram tubes. You have to patch about 1.5 centimeter at the shoulder area, or some are using near the groin area. Minoxidil, Mintop, also use 2%, 5% solution applied 2 ml. And that is minoxidil also used for the hair loss. But sometimes the patients are confused. And minoxidil causing the impotence, that is wrong, because they are taking along with the minoxidil, they are taking some steroid supplement is given by these things, hair transplant doctor or skin specialist, that may causing, but minoxidil is helping in local vasodilators. Near to the penile massage or all, you have to read the instruction. Because I have not used it so frequently. And nitrates are converted to nitric oxide that relaxes smooth muscles and causes vasodilatation. Nitrates are used for angina. Sildenafil, tadalafil should not be given to the person who are on nitrates. Always remember. 5-phosphodiester should not be used. Sildenafil, tadalafil, vardenafil should not use. Pentaerythritol is peritrate 10 mg tablet. Azorbate dinitrates, sorbitrate 5 10 mg tablet. Sublingual or oral can be used for erectile dysfunction. Prostaglandin is very frequently used by the urologists along with a papaverine injection. Is a biomix. Is a prostin is available. PGE1. PGE1 pellet alprostadil 125 to 500 microgram by must medicated urethral system for erection. Okay, fine. Hormone therapy, you should know testosterone is very commonly used. In oral is the Nuvir, Endiol, 40 mg capsule TDS with the fatty meals for 3 weeks. Injection testosterone depot 100 or 250 mg deep intramuscularly 1 ml every 2 weeks. Injection human chorion gonadotropin HCG is available in Profaci 5,000, 10,000 or 20,000 unit powder with the diluent used for ovulation and spermatogenesis in the cases of oligospermia and maybe gynecologists using in PCOD cases or not, just we find out. For undescended in a male for undescended testes. Levonorgestrel, okay, this pills used 750 microgram tablet, 2 tablets taken together, preferably with 12 hours in unprotected sex. They don't want a baby. In such type, you can use this. This name is a Norello or IPIL is very common. IPIL. You can prescribe the IPIL. Most of the time, patient ask for IPIL. Tubolone, or you put everything in your Practo platform in the medical so that you can just remember and you can, if anyone need, you can prescribe well. Now Tabolone is a 2.5 mg tablet OD for 3 months for menopause, and clomiphene citrate used for oligospermia, 25 mg for the male and 50 mg for female infertility. Okay. Female ovulation 50 mg OD for 5 days. Only 5 days in a month is given. When? The 5th day of the ovulation, menstrual cycle. Always remember, 5th to 9th. Don't give the every day. In male you can give the every day or 25 days in a month, but in female, 5th day of the cycle, start this for 5 days. But just remember, I provided this in your books. You get it, everything. Those who don't, just search the books. If not, bring your pen drive and take it from here. All the books you upload. Again you want, just chat it, I will send you again back. Male for oligospermia, okay, fertile ho gaya. Antioxidants is very common, you use. Antioxidants are substances that protect the cells against the effect of free radicals. This includes vitamin A, C, E, coenzyme Q10, zinc, selenium, lycopene, and L-carnitine. These are very common when you go for male sexual function analysis, a computerized. We have one device. There is a magnetic resonance analysis. Here you can see that most of the time patient get the A vitamin is less, C is less, E is less, coenzyme Q. At that time, zinc and selenium. You can use the these antioxidants containing these molecules, L-carnitine and lycopene. Okay. Antioxidants are also available in vegetables, fruits, tomato, papaya, watermelon, and fish and eggs. Lycopene, zinc, selenium, lycorate, L-carnitine, carnivite, various coenzyme Q10 is Q100, Q10 is available 1 TDS for 3 months, and vitamin A, C, E, zinc, selenium is in the form of cytovit, oxivit capsule is available 1 TDS for 3 months. Pharmco antimicrobial. Most of the time patient having some fungal infection and bacterial infection together, mixed vaginal infection. At that time you can advise them fluconazole plus ornidazole plus azithromycin is available in the market. Medikit or Zocon AS, 3 tablets, one morning, one afternoon, one evening, or how they does everything instruction, you read it and prescribe to your patient. Given orally, if you worry to give all the three together, they give one by one and after 2 hourly and all. Give orally for vaginal candidiasis, trichomoniasis and bacterial vaginitis. For male genital tract infection, chlamydial infection, doxycycline is again drug of choice. Doxy 100 mg OD for 15 days. Both are treated, male and female part. Ayurvedic treatment, adjuvant empirical treatment, Chyawanprash is very good rasayan. Give them 2 TSF at bedtime or twice a day, morning and evening, bedtime. Vigomax Fort 1 BD with milk for erectile dysfunction. Confido for 1 TDS for oligoastenospermia. Vivadona 1 BD for female libido. Female libido, most of the patient ask or doctor asks which drug Vivadona you can use Ayurvedic. I think Himalaya company is manufacturing this product. Coital postures, ideal coital posture is very important. Here nothing I have to say. There are a number of asanas and all. But when the patient is not conceived, at that time take the sonography of the female partner of the pelvis. If it is not, and find out the position. If the position is not normal, then advise. Find out retroverted, then advise doggy pose, intercourse, and antiverted, keep the pillow below and have intercourse. Then here my friend, man and woman similarities and differences. During 7 months of pregnancy, okay. Embryonic development, okay, fine. That's I've taken a number of times. I'm not what man and woman likes and all. We will take this from the next time because we tried our best to cover. We covered near about 100 slides today, and next Saturday we are here. We'll discussing further slides, and I will try to complete all the slides before you reach here in our remaining 4 sessions or 5 sessions of Saturday meet. Sunday meet is you can open for everyone for practical approach, and at that time you have to perform the practices of meditation, relaxation techniques, and suppose you are hypertensive, find out your blood pressure and again take it after the process, after the 2.5 hours, and take it blood pressure and keep the note, and you can write down your note. This is my blood pressure first and last, after, before, and so every visit and practice for 1 week. Then again next week we are coming with a new model and practicing that old model like that. This is for 1 year program. It is basically I started for my patient, and I think 5 to 10 patients are registered so far, and others are our doctors. Those are joined. We send them our joining link, because there are number of links that now doctors may confuse कि कहाँ जाओ कैसे जाओ. Everywhere we are getting sir आपका वही आता है. So this is okay. You can use accordingly your wish. Thank you very much.